is Jessica Shabby. I'm going to be doing the Foley insertion on a female body. Some supplies that I have is my trash bag over here on by her left hip, my soap and water, my 3 washcloths, my clean gloves, my Foley catheter kit, and this is going to be my sanitized table, so that way I can put my gloves on and be able to do it safely and clean. So I'm going to call my patient here, Mrs. Smith, just for any confusion. So I'm going to go ahead and get started. Hi, Mrs. Smith. This is Jessica, your nurse. I'm going to go ahead and do a Foley catheter on you. Is that okay? Okay. Can you give me your name and date of birth? I'm going to go ahead and wash my hands. Close the curtain. I'm going to close the curtain, close the door, wash my hands. Can you give me your name and date of birth, please? Perfect. And let me check out your wristband. Okay. So I'm going to put in this Foley catheter. Is that okay with you? Okay, great. So I will tell you every step of the way when we go, okay? So that way you're nice and comfortable. So I'm going to go ahead and raise her bed so that way it's at a good length for me to be able to look at exactly where I need to go. I'm going to lay her head back. Now, Mrs. Smith, I'm going to pull back your blankets, okay? And we'll put another blanket on top of you and kind of on top of your legs. Can you go ahead and lift your legs for me? Great job. And butterfly out. Good. Now the blanket should fall, I'm going to have it right about her abdomen so that way it's not obstructing any sanitized areas that we have going on. So first thing, I'm going to put some clean gloves. Are you comfortable? Are you doing okay? Okay. So put some clean gloves on. Now, Mrs. Smith, I'm going to go ahead and wash your peri area, okay? Okay. It's going to be nice warm water, so hopefully it won't startle you too much, but I will let you know before I touch you, okay? All right. So I'm going to grab the first washcloth, dip it in some soapy water. All right, Mrs. Smith, I'm going to go ahead and touch the top and open you up a little bit, okay? Coming with on your labia, the furthest side towards me, I'm going to go top to bottom. I'm going to do a different part of the washcloth with this one and go top to bottom on the other side. Then I'm going to take this one and go straight down the middle. And then this one I'm going to use so that way I can pat dry. Now I'm going to go ahead and assess her since I'm here. We're always needing to assess every area that we are at. And everything looks really good. And I know exactly and I see exactly where I need to go. So, all right, Mrs. Smith, I'm going to go ahead and get started, okay? Well, I'm going to get the supplies ready first, and then I will let you know when I get started. I'm going to go ahead and throw away my washcloths. I'm going to wash my hands, and I'm going to take this down so that way none of the areas are disinfected by my badge reaching over it. So I'm going to go ahead and wash my hands. Miss Smith, you doing okay still? Okay. So pulling the furthest away from me first. And then the sides, and then pulling towards me lastly, and then right on top is my gloves, so I'm going to go ahead and grab those and bring them to my table. All right, using my dominant hand, I'm going to go ahead and do the 2-finger pinch. And pinch the cuff there. And I go ahead and put those gloves on. These gloves are ripped. In any other circumstance, I would have not used these. I would have gotten a completely new kit or completely new gloves. But for this purpose, I'm going to go ahead and use them because these are the only gloves that I have for right now. So I'm going to do a couple fingers and scoop in here and do my dominant hand here. All right. Then I'm going to pinch this and toss it. Have a trash bag over there. And come straight back over here. Now that I have sanitized gloves, I can go ahead and move this any way I need. First thing I'm going to grab is this blue towel. Now, Mrs. Smith, in a second, I'm going to have you lift up your bottom, okay? So we want shiny side down. Okay, ready? Go ahead and lift up your bottom. Great job. and toss that down. Then I'm going to go ahead and grab this and toss it right on top of the vagina, just because I don't want to unsanitize my hands. It is ripped because I've used this already. I'm going to go ahead and just bring this up because it's so hard to, once it's ripped, it's hard to maneuver around and wants to stick together. Okay, now that we got that, I'm going to go ahead and get my stuff ready. I'm going to rip this off, put my 3 alcohol swabs there. I'm going to take my lube and put it in this little tray right here. Then I'm going to lift this. While I take this out, I want to coil it up, just like that. And then I'm going to dip it into the gel. So that is ready to go. And then I'm going to go ahead and prepare this. Pop this off. The tip of my syringe is completely broken, so I have no more water in this and I can't fill it up because it won't stay. So I will still insert it into the cap right here. So that way it's ready. Okay, so first thing I'm going to do is I'm going to use my alcohol swabs to clean her up. So Mrs. Smith, I'm going to go ahead and touch the top of your perio, okay? Now that I have touched her on the top here, this hand is no longer sanitized, so I cannot use it to help me out anymore. That is why we prepped everything. So first thing I'm going to do, Mrs. Smith, is I'm going to clean out in the inside of your labia, okay? I'm going to open you up a little bit and go on your right side. I'm going to go top to bottom, throw that away. And then I'm going to do top to bottom and throw that away. Just do a nice top to bottom strokes, no twisting, nothing like that. I'm going to go right in the inside and go top to bottom and throw that away. Now that that is all done, I'm going to go ahead and hold my catheter. I see where I need to go, so I'm all ready to go. Now, Mrs. Smith, you want to hold it 2 to 3 inches from the top, so that way you have a good grip on it and not keep it from being unsanitized. Okay, Mrs. Smith, I'm going to go ahead and put this in. When I put this in, I want you to take a deep breath for me, okay? In a count of 3. 1, 2, 3. Deep breath, deep breath. Good job. All right, when I start seeing when I start seeing urine coming out, I'm going to go ahead and go another 2 to 3 inches. And then this is supposed to be right here. And then I just grab this and I put the 10 milliliters of fluid in there, making sure I pop this off as soon as that's done, so that way, or take this off as soon as it's done, so that way the water doesn't start coming back into the syringe. And then I'm going to put a stat lock on there so that way it stays in place. I'm going to then take the peri bag and open it up, and I'm going to put it on the side of the bed, not the bed rail, because the bed rail can move. So we want to make sure that it stays on the side of the bed. I'm just going to pretend like it's over here for now so that I have more space to show you what I'm going to do. Now I'm going to go ahead and clean up everything. Mrs. Smith, does everything feel okay to you? It does? Okay, good. So I'm going to go ahead and just clean up real fast. And then I'm going to rip this so that way it'll just nicely come out. I should have put it on the side, but rip that so that way it comes off. And then I'm going to go ahead and toss all of that. This will not be on the trash can, but toss all of that. And then I'm going to go ahead and take off my gloves. And then I will bring the patient, I'm going to wash my hands. Let's find my badge, put that back on. Wash my hands. Okay, Mrs. Smith, do you feel comfortable? Do you feel okay? Okay, good. If you feel any discomfort at all, please let me know. If you need anything else, please let me know. I'm going to go ahead and put her bed all the way back down to the safest position. And Mrs. Smith, would you like your head up some more again? So I'm going to go ahead and bring her head up more because that is what she wants. And then I'll cover her back up. I'm going to go ahead and chart everything that I did and how well she took it as the patient. Chart everything, wash my hands, and then Mrs. Smith, if everything's okay, and if there was any urine, I would definitely measure that as well, possibly empty it if it is full, pretty full. All right, Mrs. Smith, well, I hope you have a good night or get some sleep, and I will see you later. Okay, bye.